Let's talk about being a nurse patient advocate and medications. So, what we do as nurse patient advocates is we meet with clients and families, usually in their home, and we gather all the medications that they are currently taking. And sort of what that looks like is we ask them to bring out all their prescriptions and we start documenting all of their prescriptions that we're taking. And I'm sure you can imagine how enlightening it is when you start reviewing the medications and you realize, well, this bottle is still full or this hasn't been filled for 6 months. So we gleam into that and say, okay, can you tell me more about this medication? How have you been taking it? I noticed it hasn't been filled for 6 months. And they may say, you know what, that medication, when I was taking it, I ended up having to go to the bathroom all the time. Well, can you tell me more about that? Well, I was, having to pee all the time and I was having accidents and I just no longer wanted to take that. So what we do is we document that, we write that down. Along with, we ask them, like, can you get all the stuff you take, like that you keep in your cabinet, your refrigerator, or on your nightstand? Because they're taking most likely over-the-counter medications that the provider isn't even aware of that they're taking. It also can provide clues to what is going on, right? So maybe that medication was causing them to urinate frequently, and they're also taking an over-the-counter product or supplement or, nutraceutical that maybe enhanced that need to urinate. So we gather all that information, and honestly, it can be really fun because you're truly sort of being a detective and you're writing all of this down. Well, once you have all this information, it really just does no good if you're the only one to have the information. But we ask permission from our clients that they let us reach out to their providers and share this information with them. So we reach out to any prescribing provider that we found, usually through the prescription bottles, and we let them know, like, this is currently what their patient is taking. And can you imagine being a provider and receiving this accurate and thorough medication list that most likely doesn't match what you have listed in your office? Why? When people go to their provider's appointments, they just don't understand why we ask them, have there been any changes in our medications? And the majority of people are like, no, not that I'm aware of, or they go through them. And the majority of the time, they're not even sure, the medications that you're saying, if they take them or not. And I'm not saying that this is everyone, okay? I'm just saying that there are patients out there who go to their appointments and they themselves are not aware of the medications and the over-the-counter products that they're taking. So we ensure that the providers themselves are aware. And then if there's any discrepancies, they usually reach out to us and we inform our clients of, that the changes that need to be made. So at no time are we telling anybody what to take or what not to take. We're just making sure that our clients, our families, anybody who's providing care, anyone who's prescribing, or say they live, in assisted living and a med tech is giving them their medications, or now that they go to the emergency room, that we have it well documented for that emergency room provider to know, this is really what they're taking. And then sometimes medications change in the hospital and they go to rehab, but the home meds, weren't on the med list. So we make sure the rehab, the skilled nursing facilities also have an accurate and thorough list. And that's just one thing we do as nurse patient advocates, is just make sure that we are doing a medication review and that everybody is on the same page with medications.